Hello, I'm Mike A. Christensen, and I'm from Star's Talent Studio. Have you ever been in a hospital? Ugh, it can be hard, right? While miracles happen here every day, so do illness, uncertainty, and death. These times of crisis affect not only patients and families, but the devoted staff who serve them. Tragedy can leave us feeling vulnerable and asking big questions like, why? And while there's not always an easy answer, sometimes we need spiritual and emotional support to lift our spirits and help us with our journey forward. This is where professional hospital chaplains come in. This is Gene, one of our chaplains. For those of you who don't know, chaplains are amazing and often underused. They are essential members of the care team here at the hospital. They act as spiritual counselors and advocates for the patients and staff. And while chaplains have a lot of similar skill sets to social workers, they are specifically trained in belief systems across faiths and cultures. They receive over 1,600 hours of training that is focused specifically on a hospital setting. They are board certified to help you and any individual with a spiritual need. So to those big questions like, oh, why is this happening? Gene will listen and help. As part of the care team, Gene is also clinically trained to help navigate the healthcare experience. He and the other chaplains ensure that patients' requests for care, especially those of a spiritual nature, are heard and respected. In fact, research shows that dedicated chaplains influence better decisions about care, improve clinical outcomes, and enhance staff morale. How? Well, while 80% of U.S. adults affiliate with a religious sect, 20% don't have community clergy to speak with about their concerns. Nearly half of people say that their spiritual beliefs would affect their medical decisions, and between 1/3 and 2/3 of all patients want to receive spiritual care. So having dedicated chaplains on site to understand a patient's desires and advocate for those desires helps ensure that every patient gets the best care possible. There are some instances where patients and staff are uncomfortable discussing their spiritual concerns with others, even community clergy. Because chaplains are unbiased, spiritually and clinically trained, and part of the care team, they are safe and can bridge conversations that others just can't. The trust that's built in these conversations with patients can extend to the medical team, resulting in better communication, outcomes, and an improved quality of life for patients and staff. Chaplains' supportive consultation can enhance morale and decrease staff burnout, thus reducing employee turnover and the use of sick time. One study reports that 73% of intensive care physicians and nurses believe that providing comfort for staff is an important chaplain role, and 32% believe chaplains should be available to help staff with personal problems. So as you may see, chaplains are valuable members of a hospital care team, but only 60% of U.S. hospitals have them. The other 40% rely completely on community help, which is often limited or insufficient in the hospital setting. Chaplains create a system of support that is vital to our mortal human experience, and they want to help. As Gene would say, our most fundamental mortal human condition is when we come face to face with our own mortality. As chaplains, we walk into some dark places and help bring in light. Professional board-certified chaplains help patients and staff make sense of their personal circumstances by exploring their fundamental beliefs. In essence, chaplains provide critical support in the most challenging moments of life. Their ultimate goal is to help those they serve get healthy, stay well, and thrive. For videos on other topics that affect healthcare, please subscribe to Healthy Dialogues. Thank you.